It's in recovery clinics, beauty spas, even your Instagram feed. Red light therapy promises everything from faster healing to better skin to pain relief. But does any of it actually work? In this video, I'm breaking down what the science really says. What works, what doesn't, and how to use it right if you want results. Red light therapy, technically called photobiomodulation or low-level laser therapy, is the use of specific wavelengths of light to stimulate biological processes. It does work in the 600 to 950 nanometer range, red and near-infrared light. That's important because those are the wavelengths that can actually penetrate human tissue. Red light reaches just below the skin, which is great for surface healing. Near infrared goes deeper, ideal for muscles, joints, and connective tissue. But what actually makes it effective is how your body uses that light. The photons are absorbed by a mitochondrial enzyme called cytochrome C oxidase, which boosts ATP production. That means more cellular energy, better repair processes, reduced inflammation, and in many cases, less pain. This isn't just theory. NASA started studying it back in the 90s to help astronauts recover from injuries in space. And since then, there have been hundreds of peer-reviewed studies across sports medicine, dermatology, and rehab. And unlike other therapies, it's non-invasive, drug-free, and has virtually no side effects when used correctly. So how exactly does shining red light on your skin lead to pain relief, better healing, or improved recovery? It comes down to a process called photobiomodulation, which is just a fancy way of saying light triggers a biological effect. At the cellular level, red and near infrared light is absorbed by an enzyme called cytochrome C oxidase in your mitochondria, or the powerhouse of your cells. The light absorption increases ATP production, or cellular energy, and simultaneously reduces oxidative stress and inflammatory cytokines like IL-6, TNF-alpha, and prostaglandin E2. The result, lower inflammation, better blood flow, faster tissue repair, and in a lot of cases, less pain. Let's talk actual data. A 2009 meta-analysis looked at over 800 patients with chronic neck pain. The result, significant pain reduction lasting up to 22 weeks after treatment. And with no drugs, no injections, just light. Another massive review looked at 36 randomized control trials on knee osteoarthritis. The group receiving red light therapy saw pain scores drop by an average of 17 to 24 millimeters on the 100 millimeter pain scale. That's clinically meaningful. And in chronic wound healing, like diabetic ulcers, studies show wounds close up to 3 times faster with photobiomodulation compared to standard care alone. So when it's done right, the right wavelength, the right dose, the right frequency, this isn't fringe science. It's real, peer-reviewed, and in many cases, just as effective as more invasive treatments. All right, so here's where it gets real. What does red light therapy actually help with? And what's just biohacking hype? Chronic joint pain? Absolutely. Red light has been shown to reduce inflammation and improve pain scores in osteoarthritis, particularly in the knee, neck, and shoulder. Tendinopathy and tendonitis? There's strong support for improving collagen production and reducing tendon inflammation, especially in conditions like golfer's elbow, Achilles pain, and rotator cuff issues. It's also used post-surgically, after ACL repair, rotator cuff surgery, or ligament injuries to support tissue regeneration and reduce swelling. And yes, it's effective for wound healing. Diabetic ulcers, pressure sores, surgical incisions, it helps tissues heal faster with fewer complications. One 2024 meta-analysis found that wounds treated with red light therapy healed 14 to 38% faster than control groups. Now let's clear the air on what it doesn't do, at least not reliably. Fat loss, there's no solid evidence that red light therapy burns fat in any meaningful or sustainable way. If you're seeing those claims, it's marketing, not science. Testosterone boosting, one small study got taken out of context, and now there is an entire cottage industry trying to sell red light therapy for hormonal health. The evidence just isn't there. Hair regrowth is another one. Red light may help with certain types of hair loss, like androgenic alopecia, but the results are highly variable and it's not a guaranteed solution. So if you're using red light for pain relief, recovery, or healing, you're in good territory. But if you're expecting it to replace exercise, fix hormones, or melt fat, you're gonna be disappointed. Let's be honest, most people aren't getting red light therapy in a clinic. They're buying home devices, panels, pads, wraps. So the big question is, do they actually work? To get real results, you need to hit the right biological targets. And that means wavelength, power, and dose all need to line up. Wavelength, you want somewhere between 630 and 850 nanometers. That's the sweet spot for tissue penetration and mitochondrial activation. Power density, or irradiance, tells you how intense the light is. Clinical studies often use 10 to 100 milliwatts per square centimeter, but a lot of consumer devices barely crack 5. Here's the math. If your device only puts out 6 milliwatts per square centimeter, like the DNA Vibe, it'll take 20 to 30 minutes just to reach the minimum therapeutic dose. That doesn't mean it's useless, it just means you need to adjust expectations and commit to longer or more frequent sessions to hit the dose ranges seen in the research. Let's use that DNA Vibe as an example. It hits the right wavelengths, both red and near infrared, which is great, but the power is low. That's 6 milliwatts per square centimeter. So to get a solid 10 to 12 joules per square centimeter, you'll need to use it consistently for 25 to 35 minutes per session. Also, ignore the marketing fluff. Terms like photonic synergy or bioharmonic energy don't mean anything if the device isn't delivering light in the right spectrum at the right intensity. The bottom line, some home devices do work, but only if they're built to spec. And if they're low power like the DNA Vibe, you just need to use them longer and more consistently to get the same benefits. So let's talk about how to actually use red light therapy the right way. This is where most people get it wrong. The sweet spot for pain relief and tissue healing is around 8 to 20 joules per square centimeter. Lower for surface tissues like skin or scars, higher for deeper tissues like tendons, ligaments, or joints. That means you're typically looking at 15 to 20 minutes of use, or with a lower power unit, 25 to 35 minutes to get that same effect. For acute injuries or post-op recovery, you can use red light once or even twice a day for the first couple weeks. For chronic pain or tendinopathy, aim for 3 to 5 times a week. Once symptoms improve, scale down to 2 to 3 sessions a week for maintenance. Where you place the device matters. Red light doesn't magically travel through your body. You want the light as close to the tissue as possible. For example, if you're treating a ligament injury, you want the light over the closest surface access point, not just over the skin generally. And more isn't better. Go over the recommended dose and you can actually slow down healing. It's called biphasic dose response. So start small, 10 to 15 minutes, track how you feel after 24 hours, then scale up if needed. If it starts to feel worse after use, you're probably overdoing it. And let's be clear, this isn't magic. Red light therapy helps set the conditions for healing, but it doesn't replace loading, rehab, or strength work. Think of it like this. Red light helps your body recover more efficiently, but it's not a shortcut around good training or smart rehab. Used the right way, red light therapy is one of the most effective tools you can add to your recovery arsenal. But it has to be dosed correctly, targeted properly, and used alongside a movement strategy if you actually want results. Here's the bottom line. Red light therapy works, but only when you use it the right way. Wavelength matters, dose matters, power matters. So if you're looking at buying your own device, make sure you check all of those parameters. And if you have any questions on a specific device or how to use it, drop a comment. I'll help you dial in your protocol, and I respond to pretty much everyone. And if you found this video helpful, do me a favor, hit like, share this with someone dealing with chronic pain, and make sure you're subscribed for more breakdowns like this every week.